This short video is on the rehabilitation of acute low back pain and sciatica. We will aim to keep this video as short as possible, but without compromising on vital information. If you're watching this for the second time, then we suggest you skip the short theory section and go straight to the rehabilitation exercises. The exercises are grouped into the stretching or mobilizing type and strengthening type. As the name suggests, sciatica means that there is pain or a problem affecting the sciatic nerve. But in most cases, it's not actually the sciatic nerve itself that's the problem, but the nerves that contribute to make the sciatic nerve, which come from our lumbar spine. And in most cases, it's produced by one of these classic disc prolapses. This is a segment of your spine. You've got the disc, which is a kind of a springy device. Inside the disc, we've got a slightly softer material known as the nucleus. And this softer material, like thick silicone, I would say, it works its way towards the outside of the disc, and then it either bursts, in a way, it comes out of the disc, or the disc becomes bulged, it protrudes, and that pushes the nerve just like that. You see, the disc is sort of protruding out, touching the nerve, like L5, S1 most commonly, which is the lowest part of the spine. And that nerve becomes very irritated, and then it radiates the pain through the sciatic nerve into the rest of your leg or in a specific part of your leg. So that's what they call slip disc, but it's not actually slipped. It's just prolapsed or protrusion of the disc. It doesn't actually slip as such.
And what kind of rehabilitation a person with sciatica should do?
Well, in the early stages, when it's very painful, you have to be very gentle until the inflammation, the acuteness, the spasm subsides, and then you increase the exercises according to the patient's progress. So we're going to start with something very simple, very gentle, usually sort of bringing up the legs, stretching the back of the thigh, stretching the sciatic nerve. And if the lumbar muscles, which most often they are in a spasm, try to get those muscles to become a little bit more soft and take the tension of them. So let's begin with some simple exercises, and these involve you lying on the floor. Okay, let's begin our exercises with some very simple pelvic rotation. So can I have you lying on your back? And can I also have your knees slightly bent as you have them now? And what I want you to do is slow motion, rock them from side to side. So you bring them gently to one side and then to the other side. If you keep your arms open as you have at the moment, you prevent the whole body from rolling with you. And obviously, if you're very acute with sciatica, you don't want to do this too fast or too abruptly. Very slow motion. Go to the end of range, rest it for maybe 2 or 3 seconds, and then take it to the other side. Lie on your back. So you're going to do a single leg hug. So put both hands there, or if there's a problem with your knee, you can put them behind your thigh as well. So you can do that variation. In fact, that leads to the next exercise. So by doing that, you are stretching the buttock muscles, the glutes, and they might be tight, but also you are also stretching a little bit your lumbar muscles as well. If you want to progress onto stretching the sciatic nerve, which is very important in this particular condition, you can slowly raise the leg up towards the ceiling in a slow motion until you reach a point that you can't do it anymore. If you're very acute, you won't be able to do it that far. But obviously, listen to your body at the beginning. Yeah, so that's stretching the sciatic nerve. Obviously, it stretches the leg muscles, but also the sciatic nerve, which runs at the back of the leg. Yeah. Now, another exercise which a lot of people find quite relieving is knee hugs, both knee hugs. Now, there's a bit of a caution for this because if you bring your knees right up to your chest and really push them up, what you are doing, you are rolling the pelvis upwards, and there is a risk of actually bending your spine too much and squeezing the discs and causing an aggravation of the prolapse. So that's why we start with a single leg hug, because that keeps the pelvis down, because one leg is flat. Yeah, and when you're doing the both leg hugging, start gently. Don't bring them all the way up, and don't lift your pelvis off the floor. A bit lower down.
Okay.
Yeah. So you hold on to that, and then you release them a bit, and then you repeat the same action. The next exercise is focused on stretching the glutes, the buttocks, but also a muscle called the piriformis, which is deep inside the glutes. And quite often in this condition, it can go into a spasm. So that involves crossing one leg over the other leg and then pulling up the thigh from behind with your hands. Yep. Okay. Now, it depends on your physique and your age and your condition. You may be. Are you okay in that position? Yeah. If it's a problem, then you can put a cushion underneath you so you're not holding your head up and using those muscles. That's it. That's more relaxing rather than being held up. Start with a lower down position perhaps, and then gradually pull upwards. So increase the tension gradually. Yeah. Can you switch over for me so that you can demonstrate the other leg? Yep. And very gradually lift this up. As you bring the leg up, in fact, you are stretching the glutes and the piriformis on the other side. Yeah. So there's various variations to this type of stretch. Good. You hold it maybe for 3 or 4 seconds, and then you relax it. The next exercise from that is what we call the prayer pose or child's pose, which means that you go up onto your knees and bring your bum towards your heels in a slow fashion. That's it. So you're straightening up the lumbar spine and keep your body a little bit lower if you can, and rest onto your elbows. Again, it depends on your physical fitness, how much you can achieve in the early stages of an acute phase in sciatica. So that's a good one for stretching the lumbar muscles. All these muscles here are being stretched. And if there is spasm, you will need to stretch this, plus the glutes as well. Slow motion, face down, head down, and put your bum as low as possible onto your heels. Excellent. The next one is a very subtle exercise. It's called pelvic tilts or pelvic twists. So you're twisting your pelvis without actually moving your body, but it's a very sort of internal muscle activity. So lie on your back for me. So bend your knees. So what you're aiming to do is to push your navel, your umbilicus, towards the floor by rotating the pelvis. That's it, you're doing that. So you're squeezing, you're engaging those muscles. You are also flattening your lumbar spine and helping those lumbar muscles to stretch a little bit. Breathe out as you squeeze, let the air out, and then relax your pelvis, take a breath in, and then again the other way. Yeah. Okay, so tilt your pelvis down, squeeze your tummy, your navel onto the floor, breathe out, and then repeat the same action again. Then the next one, it involves you lying face down and start with your elbows on the floor and very gently push up your body with your elbows. Okay, you may not achieve, you are a very fit person because you're a personal trainer, but someone with a lot of pain and sciatica, they won't be able to go this far. In fact, it's just a little bit of attempt of coming off the floor, so your body's going to be much lower. And as the condition gets better, you can promote a bit more extension, yeah? So you go up, you hold it for a few seconds, pause, and then slow motion, controlled fashion, rest your thorax on the floor, and then repeat again. So rest your elbows, gently push off the floor, a bit of extension, not too much. Hold on to that for a few seconds, and then in a controlled fashion, go back onto the floor. And in fact, what you can do with your arms, Andrea, go to the other side a little bit. So you encourage a bit of counter rotation. That is provided you are ready for this exercise. If you are very acute, you may not want to do this, but we're just demonstrating all the possible variation to the stretches now. Yeah, and you just pause there. Okay, the next one, it involves using an elastic band. So we're now getting into more engaging, slightly stronger exercises, provided you have progressed through the acute phase. And this is for stretching both the back of the leg, but also the sciatic nerve, yeah? So in a controlled fashion, assist your leg to go up to point towards the ceiling, Yeah, are you okay there?
Yeah.
When you reach the tension that you think that you can't go any further, stay there and increase the tension a little bit on the band so that we are stretching the back of the leg a little bit more. So you're dorsiflexing your foot, as we say, stretching the back of the leg. So you're stretching the hamstrings, the calves, but also the sciatic nerve, which is embedded in all these muscles. And don't forget to breathe when you're doing this because you're actually pulling quite a bit, yeah? And when you let it down in a very slow and controlled fashion, don't drop the legs and then get a jarring effect and then go into a spasm, yeah? Okay, slow motion, lift it up towards the ceiling. Reach your limit within comfortable boundaries. When you have raised it, dorsiflex a bit more by pulling the straps. Breathe and then relax and then repeat this a couple of times. Yeah, and just hold on to that. Yeah, using a towel. Yeah. If you want to make it a little bit more dynamic, you can point your toes up gently towards the ceiling and then pull them down if you're ready for that kind of dynamic activity. Andrea, this exercise is similar to what we've done before. On this occasion, use this leg because you need the space. On this occasion, you raise the leg up to 90 degrees if you can, point it to the ceiling, and instead of keeping it vertical there, you're going to glide it to the opposite side, controlling it with the tension of the elastic band. If you're ready for this exercise, maybe it has to be done further down in your program, but what this does is actually helps you to stretch the sides of your leg, but also the glutes and the piriformis on that side, yeah? And again, relax it so that you can get your breath back and when you're ready, because it requires a bit of control and strength to do this. So judge it when you're ready for this, yeah. Reach the tension at the back of the leg and drop it to the opposite side. Try and keep the knee straight and don't forget to take a good breath when you reach the tension point. And then in a controlled fashion, go vertical and then rest it. The following exercises involve you having a seat on the chair, especially if you're in a lot of pain. Maybe that's a good way of starting some of your stretches. Raise one of the leg completely straight with the knee straight. Gradually point the toes towards your face, holding on to that, and then slowly point them away, holding on to that, and then up again towards your face. By doing that, of course, you're stretching the calf muscle and also you're engaging your quadriceps. But by doing that, you're also moving the sciatic nerve up and down, trying to create a bit more freedom to that if it is irritated or contracted, yeah? So, yeah. If you are frail, if you're weak and you cannot keep the leg in that position, then you may put it onto another chair for support. Yeah. So you're not using your quadriceps to contract it, you're focusing on the foot exercise. The next exercise, it involves you bending slightly forward as you were in that position. So it's like doing a stretch standing, but in a sitting position. We don't want you to slouch forward and try and reach your toes because that's not good for your discs. But we want you to tilt from your pelvis, yeah? That's it. So keeping the back as much as possible in a straight fashion. Yeah, and obviously if you're symptomatic, you're going to feel the pull in the back of your glutes and leg.
I feel that.
Yeah. You see some people do it incorrectly. They try to reach towards their toes and they're flexing their spine a lot. We're focusing down near the pelvis now. Yeah. Andrea, we're going to stretch the back of the leg again, the sciatic nerve, the glutes, the hamstrings, and so forth. In the standing position, if you need support, you need to hold on to something, that's fine. Otherwise, put one leg forward for me. Yeah, a bit more if you want. Yeah. So what you're going to do is, again, tilt from the pelvis forward, not bend from your head down. So you're stretching that aspect of your body. Obviously, if you're symptomatic, you won't be able to flex that much. It might be just a few degrees, in fact, and then the pain sets in. Don't try and push it past the pain because you're going to go into a spasm and cause more problems as well. Just take it up to the point that it's comfortable but slightly challenging for you. If that is too hard, then put a small stool and put your foot on the stool instead. Like this, put your heel there and tilt from the pelvis down, yeah, and hold on to that. Or even lower, takes the tension off a little bit and hold on to that and back to neutral again. Management of sciatica. Avoid flexing or bending the spine forward. Avoid side bending, especially when combined with bending. Do not stay immobile for a long time. Apply cold gel packs. Take medication as advised. Take a bath with Epsom salt. Do not lift weights. Sit on a chair with a lumbar support and do not slouch. Regular and cautious stretching of the back muscles and stretching of the sciatic nerve. In the long term, strengthen your back muscles and core and adopt a good posture. Seek urgent medical help if you have sciatica on both sides, if you have weakness or numbness in both legs that is getting severe or getting worse, if you have numbness around or under your genitals or around your bottom or anus, if you're having problems with peeing or passing water, if you're having problems with poo or passing a stool.